The Accutel oral fluid test device is a screening point of collection test used to screen consenting donors for the presence of prescription and illicit drugs. The test is CE marked and is used extensively in Australia and New Zealand. Approved for use and complying with their strict standards of traceability and efficacy. Please ensure that prior to testing, the donor has completed a consent form and has declared all medications, both prescription and over-the-counter, which are currently used or have been over the past 7 days. Allow the donor, if requested, to examine the outer pouch to confirm the test validity date. The test supplied by Agri York 400 Limited is configured to meet the most prevalent prescribed and abused drugs in the United Kingdom. The collector, the person performing the test, should confirm that the person being tested, that is, the donor, has not eaten or drank any material within the previous 15 minutes. The device comprises 2 components, a swab attached to a stem, and a test cube containing the 8 drug strips, and also an alcohol indicator. The donor is allowed to hold the handle end of the swab and place the swab inside the mouth. The swab should reside under the tongue, and within a few minutes sufficient saliva will be collected. When this has been achieved, the stem will be colored red, and the swab can then be handed to the collector. Making sure that at no time, either the donor or collector touch the swab. The collector will then insert the swab directly into the test cube device. This will ensure that all of the collected saliva will be transferred to the base of the device and make contact with the 8 individual drug strips. This is an important feature of the unique test design. There is no place for the saliva to go, other than be transferred onto the strips. At this stage, the device should be standing upright on a flat surface. Almost immediately, flow will be observed. By this we mean the upward travel of oral fluid along the individual test strips. After 10 minutes the test can be read. For a negative test, 2 lines will be present for each individual drug. The C line is the control line, and the line must always be formed at the end of the 10-minute period. It is an indication that the test for that particular strip has worked as designed. That is, sufficient saliva has traversed the pad, and the chemistry of the lateral flow device has worked. For a negative test, there should also be a second line on the individual strip. This test line is known as the T line. A line present in this area, no matter how faint, indicates that the donor is negative for that drug, or more correctly, the drug is not present above the specified cutoff concentration for that particular compound. If the test line is completely absent, then the donor is deemed to be non-negative for that drug. To confirm this non-negative result, a second sample should be sent to an accredited lab, unless of course the donor then changes his consented donor form information and admits drug use. The presence of alcohol is a simple color change, with no control or test lines present. The pad, which is initially white, develops a green coloration if alcohol is present. Upon completion, please dispose of the cube carefully. For any questions or comments, please contact us by email at sales@agriyork.co.uk or by phone at 075 87631320.